Which part of the cardiac cycle corresponds to the T wave on an electrocardiogram, ECG? A. Atrial depolarization. B. Ventricular depolarization. C. Ventricular repolarization. D. Atrial repolarization. Answer C. Ventricular repolarization. During which phase is the pressure in the ventricles the highest? A. Atrial systole. B. Isovolumetric contraction. C. Ventricular ejection. D. Isovolumetric relaxation. Answer: ventricular ejection. Which phase of the cardiac cycle is characterized by the ventricular pressure being lower than atrial pressure, causing the AV valves to open? A. Ventricular systole. B. Isovolumetric contraction. C. Isovolumetric relaxation. D. Ventricular filling. Answer: laughing face, ventricular filling. What initiates the cardiac cycle by depolarizing the atria? A. Sinoatrial, SA, node. B. Atrioventricular, AV, node. C. Bundle of His. D. Purkinje fibers. Answer: A. Sinoatrial, SA, node. Which phase of the cardiac cycle involves the ventricles relaxing but the volume remaining unchanged because all valves are closed? A. Atrial systole. B. Isovolumetric contraction. C. Ventricular systole. D. Isovolumetric relaxation. Answer: isovolumetric relaxation. Which of the following is a correct sequence of events in the cardiac cycle? A. Ventricular systole, atrial systole, isovolumetric contraction. B. Isovolumetric contraction, ventricular ejection, isovolumetric relaxation. C. Atrial systole, isovolumetric contraction, ventricular ejection. D. Isovolumetric relaxation, ventricular systole, ventricular ejection. Answer C. Atrial systole, isovolumetric contraction, ventricular ejection. What is the role of the atrioventricular, AV, node in the cardiac cycle? A. It initiates the electrical impulse for the heart to contract. B. It acts as a pacemaker. C. It delays the impulse to allow the ventricles to fill. D. It directly causes ventricular contraction. Answer C. It delays the impulse to allow the ventricles to fill. Which phase of the cardiac cycle involves the ventricles filling passively, and the majority of ventricular filling occurs? A. Atrial systole. B. Isovolumetric contraction. C. Early diastole, rapid filling phase. D. Isovolumetric relaxation. Answer C. Early diastole, rapid filling phase. Which of the following correctly describes the atrial kick? A. Passive filling of the atria. B. Active contraction of the atria to fill the ventricles. C. Closure of the AV valves. D. Opening of the semilunar valves. Answer B. Active contraction of the atria to fill the ventricles. What happens to ventricular volume during the isovolumetric contraction phase? A. It increases. B. It decreases. C. It remains constant. D. It fluctuates. Answer C. It remains constant.